My name is Rhonda Schafer-McLean, and I'm an OB-GYN at Dakota Clinic in Bismarck, North Dakota.
And just tell us about your education.
I went to undergrad at Brandeis in Boston. It's a 4-year private liberal arts school with kind of a Jewish sponsorship, so that was unique for me coming from very Midwestern North Dakota, and did 4 years there. Got a degree in biochemistry and secondary education and pre-medicine. And then I took a few years to teach and then moved on to medical school. I did that for 2 years and then entered a combined MD PhD program. So I did research then for 2 years and actually got my PhD, and then went back for the finish of the medical school for 2 more years. So combined, usually it's a 6 to 8 year program. It just sandwiches the research in between the academic part of medical school and the clinical part of medical school.
How many hours do you normally work?
I usually work between 30 and 40 hours a week.
And what do you do in your job?
I take care of women that are pregnant, and I take care of women with women's health issues, and do annual exams and kind of screening education for women that don't have a particular medical problem.
Do you take work home with you?
No, not typically.
How would you describe the pace at which you work?
I think it's very fast. Usually we see 30 to 40 patients a day, so you know, it's a good clip.
How has your education prepared you for your career?
I think very well. From an academic perspective, I think that I have been exposed to and know the things that I'm supposed to know. I think one of the things that medical school and residency training, which is the additional 4 years that you go to after you finish medical school, some of the things that they don't address are really the functional day-to-day aspects of being a doctor. How do you set up your clinical schedule? What's appropriate? 15-minute appointments, 30-minute appointments? How do you do billing? How do you do coding? How do you manage office staff? Do you need 1 nurse? Do you need 2 nurses? What kind of nurses do you need? This kind of stuff I think is always kind of left out. And I think even if we were taught to be a little more aware of these things, we could maybe observe them in process, but it's just this thing that escapes you.
Have you worked in other jobs like this?
No, this is my first job since training.
Why did you choose this career?
I always knew I wanted to be a doctor from when I was a little girl, maybe 6 or 7 years old. I chose OB-GYN above the other specialties because it limited the medicine to one system, basically, and it also limited to one gender, but it allowed me to do clinical medicine, surgeries, education, and it was active as opposed to just all mental, and thinking about labs and thinking about medicines. It was actually a hands-on sort of specialty.
What goals do you have for yourself in your career?
I always have the goal to take the very best care of each patient that I possibly can. I think that's a long-standing goal. I don't think that will change. I have goals probably to increase the amount of time that I spend with education and educating medical students and nursing staff, and just that academic and educational bent is probably really strong for me.
What do you think it takes to be successful in this career?
I think you have to just stick to it. I think it's very hard some days because it's just long. You have to go through 4 years of undergrad, 4 years of medical school, 4 years of training. That's 12 years before you actually get into your first job. And there are huge tests along the way and just a lot of things you sacrifice. So I think overall, just, be smart, be energetic, and stick to it.
Do you travel for your job?
No, I don't. That's not true. I did start a satellite clinic in a rural town just recently because I felt they were a little underserved, and some of the women there probably weren't getting the specialty care that they could get if somebody would go there. So once a month I go there.
What do you find are the most difficult decisions to make?
The ones where there's no right answer exactly. There are a lot of decisions in medicine where you have choice 1 and choice 2, and you won't know until much later, if you ever know, which was the better of the 2 choices. And I think those are the more challenging. I think they're getting easier as I'm in my position longer. You just realize that there isn't in fact a right choice, and you have to choose from 2 reasonable choices.
Do you work independently or on a team? And if you work on a team, can you give us some examples?
I work fairly independently, but I have two nurses that help me out directly. And as of the last year, I've begun a job share program with another OB-GYN. And so in that way, I work more closely with her than I typically would work with any other partner, and her nursing staff as well.
Any advice that you would give to a young person who thinks they might be interested in being a doctor or an OB-GYN?
I think, again, the most important thing is, if you have the smarts to do it, if school is easy for you, and you really care about people and want that interaction every day, just be ready, for this to take time, years, decades, and make it part of the piece that you enjoy about it. Everybody else will have their job, and you'll still be trying to get one because you haven't finished your training. And it's just a different kind of tenacity, and that's okay as long as you're ready for it, so be prepared.